Hey guys, this is Dr. Pat, and today we're going to be talking about arthritis. This month, the month of May, is Arthritis Awareness Month, so it's really important that we address this very common musculoskeletal condition. Arthritis is one of the most common things that we see in the office. It's estimated that 1 in 5 Americans suffer with some form of arthritis, whether it's degenerative arthritis or osteoarthritis, rheumatoid arthritis, psoriatic. There's lots of different types. The most common is probably osteoarthritis, and what it is it's when the cartilage, in and around the joints begins to break down, and so what that results in is a decrease in that joint space, and so there's inflammation that's created in there, and it's painful to move, and so over time these things tend to get worse and worse, especially with age. So if you take a look here, we're going to talk about the spine for the purposes of this video. So here we have a single motion segment, which is 2 vertebrae and the joints that are in between them. As you can see here, this is a normal disc. It's nice and full. There's a good space between the 2 bones. And there's a lot of hydration in this disc, which makes the shock absorption and movement very easy here in the spine. Over here you can see what an osteoarthritic spine would look like. You can see that the disc space is smaller here. The disc is a little bit more dehydrated. It's not able to move as well. And we can also see some bony formations forming on the sides along here. And especially over here, we actually have what's called a bone spur, basically. And what can happen is as these layers of cartilage have broken down, it's causing inflammation, discomfort, and stuff, and so it makes it really hard to want to move those joints because of how they make people feel. But the thing is that motion is really what's most important for preventing, or not necessarily preventing, but delaying the onset of these degenerative processes. Degeneration is something that happens to everybody, but the rate at which it happens is something that we can actually control. If you exercise, move, regular chiropractic care is great for maintaining motion in the spine. With that we can keep those joints moving, keep everything in alignment. And over time the benefits really speak for themselves. So people are able to maintain movement for longer periods of time, have a little bit more independence as they age. And so it really becomes a matter of moving as much as we can, because that's really what feeds joints and allows them to function as well as possible. So hopefully this video gives you a little bit information about arthritis and some of the changes that can occur in the joints. And if you have any questions, feel free to call our office at 217-726-0422. And if you like, we can get you set up with a consultation. We can talk about these things more. So hope you guys have a great day. See ya.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.